Hi there YouTube, it's Karen, aka Shrieking Goofball. I'm home. Surgery was Wednesday, the 7th of November. I got home on Saturday. I was only kept one extra day. My oxygen was a little bit on the low side. Apparently your oxygen's supposed to be at 100%. My oxygen was only at about 80, 82. So I was fortunate enough to get to wear the little finger doohickey that records your oxygen. The cool thing about that now is it's actually like a one use. I went for a sleep study, I think it was in, I want to say September, October. And it's the kind, I'm sure you've had them before where they just actually put them on your finger. And of course during the sleep study, mine was falling off. I had, wires everywhere, wires, and then this little thing attached to your finger just flies off. So this one is actually kind of taped to your finger, and it was monitoring my, my oxygen. So my oxygen was too low and my heart rate was too high. Blood pressure normal, go figure. So anyway, they didn't actually worry too much about the beats per minute being too high. And that makes sense to me because when you're overweight and you have advanced osteoarthritis, you don't work out, you don't walk, you don't exercise, so you're out of shape. So yeah, every time I get up to go to the bathroom or pick up a pencil off the floor, I'm going to be like, up to 136 beats per minute. So they kind of stopped watching that and they continued to watch my oxygen until it got to about 95%. So when it hit a consistent level of 95% at room air as opposed to oxygen, they let me go home, which was nice on Saturday. A little bit about surgery. I was greeted with the biggest wheelchair I've ever seen, so I guess that's kind of cool because it fits everybody. That's obviously going to be going for gastric bypass as well. Very quickly was, told, here's the doctor, he's here. He came and said hello, and off I went. And before I knew it, I was upstairs complaining that I wanted more morphine. Who wouldn't, right? I mean, my pain was mostly up here. You can't see that. That's right underneath my chest. They pump you with air, obviously, with laparoscopic surgery. Right underneath my chest. So obviously they want you walking a lot, passing gas. That's really flattering because it compresses things. So that's part of the problem with the lungs, is because if you have all this extra gas, then everything is sort of pushed. So they want you passing the gas so your lungs can expand. They're giving you lots of things to do to practice to get your lungs fully expanded as well. So the pain did suppress after a while. It did take a while to get that gas rolling. I did have a bowel movement on my, I think it was Friday afternoon. I love how they get all excited. Oh my goodness, good for you, you had a bowel movement. They were giving me benefiber, of course the word fiber, meaning, they don't want you to have constipation because they don't want you struggling while you've just had surgery. And I told them that I have irritable bowel syndrome. Sorry if this is too much information, but there's no such thing as being constipated. Anyway, since I've been home since Saturday, I have had major diarrhea. So I'm talking 4, 5, 6 times a day, so I should be 100 pounds lighter, but I'm not. Just to give you a quick update on the weight, I was down just a little bit over 24 pounds after I completed my 3-week of Optifast, my liquids and my cucumbers. And when I got home on Saturday from the surgery, I was probably down another 5 pounds. So I think I'm about 32, 33 pounds right now. My scale is pretty precise. It does to the decimal, so I think I'm like 32.8 or something. I'm going to try to stop like getting on the scale every single day, because even though it's been good results, I'm afraid that if I don't see that movement every day, it may discourage me. So I think I should be looking at about 1 time a week, and that should be enough. I'm going to be calling my probably nurse today just to confirm a couple of things. My doctor did sort of suspend most of my medications, which of course would also be painkillers for my osteoarthritis. I have been taking it as easy as possible and my knees are not too bad. I'm still taking these. I don't know if you did these in the hospital at all after surgery. This is how they come in the hospital. They're very tiny little needles. and they're an anticoagulant, so no blood clotting, and it's a blood thinner essentially. I got 8 of them when I came home. They were about $17 for 8, which of course means they're probably pretty expensive because I have a very good health plan. Just to show you the needle, okay, it looks kind of giant from there, but if you can see it in my hand, you can see how tiny the tip is. I have never had such bad bruising. Now, I don't want to show you my stomach, so I'm actually going to show you my phone. I just wanted to keep these pictures for, you know, a memento of my journey. So yesterday I went to do, because what you have to do with the shots is you have to do them on your belly, which I've never had to do before. I've never had to give myself a shot before, but in your belly, 3 inches away from your navel, all in different spots, trying to alternate from side to side. So this is kind of how they've been looking. That's my belly. This is the one that I was most concerned with. This is a smaller one. There's a smaller one. That's just one side of my stomach. The other side kind of looks the same. And then yesterday, while looking for a new spot, I found this. Isn't that nice? It's such a pretty color, don't you think? Like a, I don't know, it's black and it's really more purple. Let's just see if I can show you another one, just to give you an idea. It looks like I've sort of been kicked by a heel. Anyway, so I'd like to ask the nurse about that. I'm sure it's normal. I don't think anybody's told me that that's what I was supposed to expect, so it'd be nice to hear a nurse say, oh yeah, that's no problem, they're blood thinners. So you know, don't worry if you get, you know, these monstrosity of bruises. So I was a little concerned yesterday when I found that one because it's pretty big. So I do that once a day, normally at night, and I've got probably 3 more left, so 3 more days. My diet's going along really well. You know, I don't have an appetite, I'm not hungry, so I think really I was a boredom eater. When I was emotional, meaning anxious, I didn't eat. So I think I probably ate in boredom. So eating 3 meals and 3 snacks a day has had its challenges for me because I've been home from the surgery, of course, and home since July 21st with my osteoarthritis. And I kind of wish I weighed myself when I first came off work because I probably gained a good chunk of weight between July 21st and when I started my, having such a hard time keeping my thoughts together, my surgery. So, no, not even my surgery. My October 17th when I started my octofast, and I lost 27 pounds, so that was really good. So yeah, things have been going pretty well. I think I've kind of overdone it. Need to do a little bit more relaxing, but yeah, having trouble sleeping. Not sleeping, getting to sleep. I'm a little bit anxious. My knees, do you ever get like restless, I call them restless legs, and apparently it is a syndrome, and I will be seeing a specialist, well, the same one who did my sleep apnea, that I have to wear the mask, and he said that it's a real syndrome, and asked me what I experienced, so that should probably, yeah, he should be able to give me something, or exercises, he didn't even say, but he said that there is a way that I can get rid of that, and that would be really nice, because starting about the evening, about 8:30, 9 o'clock, I can't sit still, and it's really annoying. So if I think of anything else, I'm doing this sort of quickly, almost out the door to get my son from school. I've taped this segment at least 4 or 5 times, a couple of times with my cell phone. After 2 minutes I run out of sound, so you don't hear the sound either, you don't know what I'm saying because you just see my lips moving. Then I taped it again on my son's iPad, which is what I'm on now, and I did it a 21-minute video. So obviously had a lot to say. Excuse me. 1 second. A frog. Yeah, I obviously talked too much, and I couldn't upload the 21-minute video. And there is a setting somewhere to change that, to be able to upload a longer video, but it's not my toy, it's my son's. So I decided I'd come back again and do a shorter one. So if I think of anything that I might have missed, maybe I'll do another one, because I really wanted to get on here and sort of just do my weekly, because my week would have been yesterday, because I did my 43-second video the morning of my surgery. So we'll talk to you soon, YouTube. Ciao.